Hi everybody, in today's video we're going to show you guys how to take an FMX using the snap array and a digital sensor. So let's go ahead and get started. Alright, so I've got my sensor barrier, okay, and then this is going to be the snap array that we actually use for digital. So again, as we've mentioned in previous videos, you want to make sure that you are starting with the anterior teeth first. The reason why we start with anterior teeth is because they're more comfortable for the patient to tolerate and less likely that the patient's going to gag. So this particular side is going to be the side that you actually use to place the sensor in. So you want to make sure that you place it in like so with these little rubber stoppers, and then you're going to squeeze this down as tight as possible so that way it holds on to that sensor, okay? So this is pretty much as secure as I'm going to get it. The other part you'll notice is that I don't really see much of this sensor underneath the bite block. The idea is on a periapical film, we want to get this as high up in the bone so that way we can see the apex of the root and the bony structure around each tooth. So when you're placing this, you're going to make sure that you kind of hold it out more so like this rather than up here like this or, you know, like that. You don't want to hold it like that because it's going to be more difficult and your fingers are just going to get in the way when the patient bites down, okay? So again, with an FMX, we're going to start with a canine PA on the upper right, and then we're going to go to the central, the canine, and then down below to do the canine, the centrals, and the canine. So with this particular one, we're going to go ahead and place it in. You'll notice the angle that I place it in at. I'm going to go in like this, and then that way so I can get this inside of the patient's mouth and seat it upright like so, okay? And then I'm gonna have the patient bite down gently. You don't wanna have them bite down too hard because then what it'll do is it'll shift that sensor out of that holder. Now we need to set our vertical angulation. Our vertical angulation for a maxillary cuspid is gonna be positive 45 degrees. So when I set my vertical angulation, you're going to actually see this is what a positive 45 degree angulation actually looks like. So the PID is angled downward. Now when I go to place this PID, I'm going to turn it and stand behind the PID to help me locate or line this up where I think it needs to go, okay? So the idea is that this pretty much is centered over the the center of the PID is centered over the ala of the nose on the patient's right side. So a couple of things that you can do is you can take your cotton tip applicators and you can basically line them up on either side to make sure that you have it centered within this snap array right here like so. The other thing is lining this up to make sure that this is down far enough to where it's going to get the bottom part of the sensor. The bottom part of the sensor is actually like right there, so that's good. But if I was down too far like this, I'm going to end up getting a cone cut. If I was up too high like this, I'm going to end up getting a cone cut. And we'd probably end up taking an x-ray of the patient's eyeball instead, right? We don't want to do that because where are the teeth? They're right in this zone right here, okay? So this is pretty much it. The big thing is too, is if I stand behind, I know that this is actually centered with the sensor. If I stood off to the side, it might look like it's lined up, but then in reality, it might be too far off from one side or the other. And so then I would end up getting horizontal angulation or overlapping as an error, okay? So the next one we're going to do is we're going to end up moving over to do the central. So we're going to go ahead and place it in like so, seat it up on the palate and then up on the incisal edge of the teeth and then have our patient bite down. And then of course with our PID, we need to make sure that we're using the proper vertical angulation. So our vertical angulation for our adult central or laterals is going to be a positive 40 degrees. So I'm going to go ahead and adjust that to my positive 40 degree, okay? And then I'm going to basically center this directly over the patient's nose, making sure that I have it down far enough to where it's going to end up getting the bottom edge of the sensor and not cone cutting it like we don't want it to do. So now, again, I can kind of use these two little cotton tip applicators on either side to line that up, okay? So you'll notice that that's how it would look when we do that particular exposure. So next we're going to do the canine on this side, and again you're going to go ahead and center it with the canine, okay? Then you're going to have the patient bite down like so, and you can still see part of the sensor actually below the tooth. Okay, so now we're going to do our positive 45 degree angulation again. Need to rotate this around so that way it doesn't get stuck. And then I'm going to go ahead and stand centered behind the patient, so that way I line it over the ala of the nose, centered. And then I'm gonna actually reposition this just a little bit to get it more centered with the canine. That looks pretty good right there. Awesome. Okay, so now we're gonna go ahead and center this directly over that sensor. I think that looks great. And then from this angle, you'll be able to see really well how these actually look when we do it from side to side. And then again, when we do from top to bottom, you'll see that this is gonna go below where that sensor actually is right here, okay? So that looks pretty good. All right, so now for the mandibular, we're going to go ahead and just not do anything different other than flip it upside down, okay? So it still looks like it's mounted in the snap array pretty well, but if for some reason, if it gets, you know, loose or something, just reposition it and start back over again. So now this one is gonna be centered over the mandibular canine. Have the patient bite down gently, okay? And with this one, our vertical angulation for our mandibular cuspids is gonna be -20. So remember, the PID for negative, it's gonna point upwards, so the opposite of what you would think. So -20. And then now, again, we're gonna come over here and we're gonna center this behind our PID. I'm gonna have to move the camera a little bit back further to do this one. All right, and then we're gonna center it just like so. So this is almost gonna kind of be slightly above where this snap array is at, just to make sure that we end up getting the part of the sensor that's slightly above the bottom of the bite block there. Okay, and then you'll want to make sure that, of course, you have it centered from side to side. I know that that's not a great picture for the camera, but we actually do a demo of this when we're doing, so if I can show you like that. There you go. Okay, so let's do the centrals and then we'll have a much better picture of that one. So now we're going to move this to where it's centered with the centrals, 24 and 25. Okay, just like so. And then this one for our mandibular centrolateral, it's going to be -15. So we're going to make that adjustment accordingly. And then we're going to go ahead and center this between, move that just a little bit. And we're going to center this right here in the middle. That definitely does not look like it's centered from there. There we go. Just to make a slight adjustment to it, that's perfect. Okay, so now we're gonna go ahead and move it like this. And some people might say, you know, that looks like it's kind of far away, and when we were doing the paralleling technique that it was actually close up. With these new machines now though, they don't necessarily, we don't make an adjustment with the long or the short cone PIDs any longer. This particular distance would not really affect the image that much, but with this snap array, you can't actually go closer to it anyways, because otherwise it would be inside of the PID. So this is pretty much as close as what we're gonna be able to get it, okay? So that pretty much looks like it's lined up with the center of the snap array. Okay, now next one we're gonna do, of course, is gonna be the canine. And this is gonna be on the patient's right side. So for our cuspid, we're gonna go back to that -20 degrees with the PID pointing upward, and we're gonna place it in just like so to where it's centered over the canine. So these are really easy to kind of see directly behind the PID. So I always stand in front of the PID when I'm placing my anterior films. You'll notice that when I stand, I'm standing off to the side on all of these videos, and I can kind of show you the way that our chairs are set up. I'm gonna have to pull this out like so because everything got stuck in there. Okay, so you'll notice that these are actually almost like salon chairs. So what I do is I actually stand over, kind of like off to the side, and straddle the front edge of this chair because it helps me to see. I can kind of like lean forward, and then I can lean off to the side when I'm looking at the side of the patient's mouth. So it helps me to line up my vertical and my horizontal angulation. So the next one we're gonna show is gonna be the bite wings. Now we did show the bite wings a little bit more thoroughly in one of the other videos with the bisecting technique and the bite tab. So I'm gonna go through these fairly quickly because I have a separate video on these all together. So we're gonna go ahead and line that up like so with our bite block. We're gonna place this in, making sure that we dive in with that front corner to get that tongue out of the way. making sure that we're lining up our proper packet placement. So I've got the distal of both maxillary and mandibular canines, keeping it parallel because it's resting against the lingual surface of the teeth, setting my vertical angulation for a positive 10 degrees. And then now I'm just going to kind of eyeball this to where I look like I've got it set up. Again, your cotton tip applicators are going to be useful or helpful to make sure that you line this center of the PID up with the line of occlusion where the two teeth, the upper and the lower arch, come together. And then that looks pretty good right there. And then of course you want to check your horizontal angulation. So this looks pretty good. Those two things look very nice and parallel. Okay. The big thing is making sure that you're not holding this like this or like this. So you want to make sure you're holding it out like as if it is an extension of that sensor. Okay, so that looks pretty good. The other thing that I normally do is if this is, I will usually use the teeth. If this, because sometimes, you know, some people might not like to use this as the setup or the lineup. So you can actually place this over the premolar and then use another one to place it over the PID. So either way that you want to do it, just to make sure that you're lining up for proper horizontal angulation. So then for this one, we would end up doing a premolar and a molar on the patient's right side, and then we flip this over, and then we're going to go ahead and do it premolar and a molar on the patient's left side. So now, again, the reason why I went through that so fast was because we have a separate video for all of that. So now let's show how we're actually going to do this posterior PAs using the digital snap array. So you're going to place this in like so. So the bite block, the thick part, should be where the teeth bite, and then this has to go on the lingual surface, right? So if I set this up like so, this is going to work for my maxillary teeth, okay? So you want to make sure that you can see the flat part of the sensor, okay? That this isn't going down too far below that bite block. And then you're going to basically line it up like this. And remember, these are the PAs, the same packet placement that we use for the bite wing. So we're going to use distal of the canine for this, the premolar PA, and then we're going to use distal of the second premolar for the molar PA, okay? So I want to make sure I'm far enough forward to get the distal of the canine, making sure that I have it parallel. So this is not parallel, this is not parallel, this is parallel. So I'm going to have my patient bite down. I'll move this over here a little bit so you can see it a little bit better from the front of the patient's mouth. And then for this, our PID placement for vertical angulation is going to be for the maxillary premolar, positive 30. So we're going to set this at positive 30, and we're going to go ahead and bring this in like so. Now with this one, remember with the bite wing, we lined it up to where the middle of this was even with the line of occlusion. We're not doing that now. So the big thing is we want to make sure that when we're lining up the bottom of it, that the bottom of it does not go below like where this bite block is, right? Because the sensor sits right here flush with that area. So, and then of course, if we had it down too far like this, then we're looking at more like a bite wing. So we want to make sure we're getting it high enough up. Now there are facial landmarks that you can use for the front of the PID. So normally if you're doing a premolar, you're going to use the inner canthus of the eye to kind of line up with the front of the PID. If you were doing a molar, you're going to use the outer canthus of the eye. So that's going to be this outer part of the eye or the inner part of the eye. So those are just some general facial landmarks that you could use. But again, I recommend you just kind of eyeballing it and then using your cotton tip applicators to make sure that you've lined it up correctly. So I can actually see the front edge of the sensor here. So as long as this is going beyond slightly, not too much, but slightly, then I'm not going to end up getting any kind of cone cut. The other thing is that this is an extension of this. So you use that as making sure that the sensor is parallel, and then you can use the face of the PID for that as well. And those probably look like I could do a little bit of a better job. So let's just adjust that accordingly. So now this and the cotton tip applicator are parallel, making sure that the sensor, the teeth, and the PID are all parallel. So I don't have any issues or errors with overlapping contacts. So that's pretty much it for the premolar, and then now we would go ahead and do a molar. So for the molar, we're just going to push this back a little bit further, making sure that it's parallel. And then of course our vertical angulation for our maxillary molars is going to be positive 25. So we're going to just adjust that slightly. We're going to line it up and we're going to eyeball it. Okay, so again, just like so, making sure that this is not too far up or too far down. okay? So I'm gonna go through this fairly quickly because this is gonna end up being a little bit of a long video if I don't. All right, so now we would end up being able to use the upper right for the same size as the lower left, right? So we're gonna go ahead, make like a TP, dive in with that front corner, and then make sure we're far enough forward to get the distal of the canine. So we're gonna just move this over here slightly so you guys can see that one, okay? And then we're gonna have the patient bite down. Sorry, Dexter's tongue is not cooperating to keep it into the floor of the mouth. It's usually a lot easier to do this on an adult, but also the cord for the sensor is kind of getting in the way of the anterior teeth, so I just made the adjustment to come out on the top. So that's something that you'll want to make sure that you pay attention to. Do you see how it's actually moved that sensor up higher? So I'm just going to kind of push that down lower. Yeah, now it goes down into the floor of the mouth much better. So now I can have the patient bite down like so, okay? All right, that looks pretty good. So now for our mandibular premolar, it's going to be a -10. So I'm going to reposition my PID at a -10, and then I'm going to bring it over around. And then I'm going to line this up accordingly. So again, first just start out by eyeballing it. That looks pretty good. The big thing is making sure that you're not going much below the bottom of the jaw like so, because if you go too far down, you're going to end up getting a cone cut. And there's no teeth below here, so we don't want to do that, right? Okay, so with this angle, we also want to make sure that we're not too far up either. So again, think about where the top of this is. When they bite down, that is not going much above where that is right there, okay? And then the other thing is using this as an extension of our PID, or sorry, of our sensor. Then I line this up like so, and then those two things look parallel with one another if you're looking at them from the front. Looks good? All right, so now let's go ahead and move on. So the last one we're gonna show you on this side is going to be your molars. So we're gonna push this back just a little bit further, making sure we get the distal of the second premolar in the film. And then now we're going to use a -5-degree angulation. So this is very close to 0. And then we're just going to, again, kind of eyeball it and then check all of our work. So you can see that this is pretty much flush with the bottom of the mandible, so that's good. And then we want to make sure that this is parallel. So we're going to move this back just a touch more. So that way I can line this PID up with our snap array and make sure that that looks pretty parallel. So again, if you look at it from the front, you can see that both of those things are fairly parallel with one another. Okay. So now we've done the upper right and the patient's lower left, but how do we end up doing up top on the upper left and the lower right? So the only thing you would have to do with this snap array, see how it's down below? With this, all we've got to do is open it up. And then now we're going to move the sensor up on the bite block holder. Okay, making sure that it's all the way forward, and then we're going to go ahead and secure that in place. Okay, so now we've got this set up flush to do up this way, patient's upper left, and then again, the patient's lower right side. So those are pretty much the same settings that I showed you previously, and so we don't necessarily need to go over all of those again. You just need to make sure that you're using the proper vertical angulation and that you're checking your horizontal angulation, your vertical angulation, and your cone cutting. Good luck!